Welcome to Working for Women, the Independent Women's Forum podcast, where we are changing the conversation about women and public policy for the better.
Thank you for joining us today on the Independent Women's Forum podcast. I'm Inez Stepman, and I'm speaking today with Hadley Heath Manning, IWF's Director of Policy, who has spent a ton of years of her career working in healthcare policy and is a real expert in this area. Welcome, Hadley.
Hey, thanks for having me, and thanks for billing me so highly, although I like to pretend like I'm pretty young. I don't have a ton of years of work.
No, she's young. Yeah, I mean, for her age, she's very young, but she has spent a lot of years of her young life in healthcare policy. We'll clarify that right off the bat.
If you work in healthcare policy, it puts a lot of years on you. Maybe we can put it that way. It's a stressful policy topic.
So today we'll be exploring how healthcare impacted the midterms and then where healthcare policy might be going post-midterms and beyond. So if you were listening to the media coverage around the midterms, issues like the Kavanaugh hearing, protests from the left, political violence, those issues kind of dominated in terms of the media coverage. But 41% of Americans said that healthcare was their top priority for the election, the thing that was most important to them for these 2018 midterms. Can you tell us a little bit about why Americans continue to prioritize healthcare as one of the key issues in elections?
Yeah, that's a interesting percentage, that 41%. It was the plurality of voters citing healthcare as their top choice. But if you look below the average, you'll see it was actually a much more important issue for Democrat voters than it was for Republican voters. More Democrats say that they believe healthcare needs major change, which is kind of fascinating when you think about the last major change took place under a united Democrat government with President Obama and his party having both houses of Congress. They passed the Affordable Care Act, of course. But about half of Democrats in this cycle were running on the Medicare for All topic, and also a lot of healthcare voters citing as their main problem healthcare costs. And we can look at the data and we see that healthcare costs continue to be a problem for many Americans. Obviously, on both sides of the aisle, we're affected by this. American companies, the American economy, and American individuals are paying more for healthcare than we ever have, and it's consuming about 18% of our GDP. So I think people are citing this as the main issue because it's an issue that they continue to see as problematic.
Yeah, and you mentioned, of course, the last major overhaul of healthcare was Obamacare. And Republicans ran for 7 years on repealing Obamacare. But as we all know, Republicans are gonna Republican. And they failed to deliver on repealing Obamacare. And something that had been sort of their mantra for years, that every Republican candidate had run on the fact that when they didn't actually control the presidency, they made sure to pass a repeal of Obamacare a gazillion times. But when the chips were actually down, they did not repeal Obamacare. Do you think that would have helped them in these midterm elections, hurt them? Where is the Republican Party on Obamacare, on fixes to healthcare? What can they do, and what should their message be going forward?
Yeah, that's a bunch of great questions. And bottom line, I think the Republican Party should have repealed the Affordable Care Act when they had the chance. I mean, not only would this have advanced a policy goal that they've been, as you mentioned, promising to their base for, election after election. This is something that they ran on. It was a promise that they made and a promise that they broke. And I think if you're a Republican in Congress, it's got to be exceedingly frustrating to look at this topic, because people may forget that in 2017, Republicans came just within an inch of actually doing something on healthcare. The House passed the American Health Care Act, and the Senate almost passed it. I mean, they were using the budget reconciliation process and they were short one vote. Everybody remembers John McCain giving this bill the thumbs down, and that was effectively the end of Republican efforts to repeal and replace the Affordable Care Act, at least in the last term. But I think not only would it have advanced a policy goal when they had the chance, but it would have riled up the Republican base and proved in the same way, sort of effectively, that the Kavanaugh issue did, that Republicans are capable of having a backbone. I think there's still a lot of distrust for Republicans when it comes to entitlement reform. A lot of Republican voters want to see entitlement reform, but they recognize that when you send people to Washington to do that, it often doesn't actually get done because it can be such a politically fraught issue. And not only that, but I think the Democrats were able to capitalize on the issue of healthcare, even in the absence of any real changes to the Affordable Care Act because they ran on sort of this spooky, fictitious counterfactual that we'll never see. They were able to depict the Republican efforts to repeal the ACA as if they had succeeded, pointing to a Congressional Budget Office report that said, 24 million American people might not have the same insurance coverage under the new repeal and replace legislation. They said, people with pre-existing conditions would be locked out of the healthcare system. And they made a lot of hay on those points. They made a lot of ads. They spent a lot of money on those points, sort of criticizing Republicans. But the problem with that is that we'll never really know. If at least if Republicans had put in place their legislation, then Americans would have had reality to check those claims against. But, voters didn't have that reality. And so the fear mongering, I think, was very successful in most cases, because across the country, about 58% of voters said they trust Democrats on the issue of pre-existing conditions more than they trust Republicans. Only 34% of people said they trusted Republicans. But two interesting factoids, data points under that, is that a couple of states, the Republican candidates were able to fight that particular measure to a draw, meaning about half of voters said they trusted Republicans, as much as Democrats on the issue of pre-existing conditions. And those states just happened to be Indiana and Missouri. And we saw Republicans picking up Senate seats in those states. So I think that was really a very critical topic of debate, something that if Republicans were able to fight to a draw on the pre-existing conditions piece, then they were able to effectively, win the election.
Yeah. So speaking of pre-existing conditions, are there any sort of policy fixes to Obamacare now that the House is flipped? It's not likely that Obamacare and the Affordable Care Act will be actually repealed. It wasn't even repealed when Republicans controlled the House. So, are there any bright spots for healthcare policy for conservatives? Are there some things the Trump administration might be able to do, or fixes that might actually garner some bipartisan support? Just things that are clearly not working within the Affordable Care Act that need. We might be able to convince Democrats and Republicans need to be fixed?
Yeah, one of the underreported stories of the first 2 years of the Trump administration, I think, is how much has actually been done. For example, when Congress passed the Tax Cuts and Jobs Act, they were able to reduce the individual mandate penalty. That's the tax penalty people pay for not having health insurance. They reduced that to zero, so that effectively repeals the individual mandate. In another bipartisan budget bill, they were able to repeal the Independent Payment Advisory Board, or IPAB, which is part of the Affordable Care Act that created a 15-member board of appointees. These people would not be elected to serve 6-year terms to effectively make cuts to per capita spending in Medicare, which is a great cause of concern when you consider how cuts to Medicare can affect seniors' access to healthcare services. Sarah Palin referred to this board as a death panel, and it would have effectively resulted in rationing. So that was good that they were able to repeal that board. And the Trump administration, without help from Congress, was able to expand access to short-term, limited-duration insurance plans, basically expanding the amount of time that people can use these plans so that they can, more or less compete with the Affordable Care Act plans in the marketplace and provide a more affordable alternative to the ACA plans. And they were also able to make association health plans more available. And those plans, if you're someone who's self-employed, you can now join an association health plan. And this can save some consumers up to $9,700 a year in premiums, according to a study by Avalar. So there's a lot of bright spots already in what the administration's been able to do. And I think politically, the administration and Republicans in general should be touting these accomplishments a little bit more, because I think they represent generally the direction that conservatives want to go in healthcare, which is expanding the choices that are available to people, creating more market competition, which does drive costs down. It's the only way to effectively drive costs down. I don't know that Democrats are necessarily going to get on board and head in that direction with Republicans. Maybe some sensible Democrats will recognize that more choices doesn't necessarily take protections. It doesn't take protections away from people. For example, people with pre-existing conditions. It doesn't change anything about the rules that apply to ACA compliant plans. But Democrats instead, I think they have a lot to work out internally in their own party in terms of which direction they want to go on healthcare because, as I mentioned, about half of Democrat candidates in this cycle were running on Medicare for all.
So let's talk about Medicare for all. We hear a lot about the cost. I mean, what would happen if Medicare for all was implemented in the U.S.? What do you think the consequences to the American healthcare system would be?
Oh, I mean, they'd be sweeping. What we have today is so convoluted and so messed up. I really can't blame anybody for, wanting some very major changes to come to the way that we pay for healthcare. We do have a lot of third parties paying for our healthcare. It's insurance companies, mostly insurance companies who are engaged by employers to offer coverage as a on-the-job benefit. That makes it very difficult for people who don't have sort of your traditional full-time job to access those benefits. And so, yeah, if we had single payer, we wouldn't have an employer-centric system anymore, meaning everybody would essentially have the same kind of access to coverage. And I think the way Democrats want to get there, I think the way they may have to get there is by first offering what's called a public option. So more or less, they would pretend as if the private market's going to continue to operate similar to how it has been. And they'd say, well, here's, we'll just allow people to buy into Medicare, buy into Medicaid more accurately. And I don't think this would last long. It's hard for the private market to continue to compete with government when government offers subsidization to the public option and, only taxes and regulates the private options that are available. So it's really not a level playing field. And we can't pretend like that kind of competition is really going to last long. Look at Medicare today. There's not a lot of seniors who aren't enrolled in Medicare, for example. And if they do enroll, if they choose not to get their Medicare benefits, then seniors also have to opt out of Social Security, which is a real form of coercion, in my opinion. But the way our health care system would respond is pretty clear in the way that they already respond to patients who are in Medicaid or in Medicare to a lesser extent. Those programs offer certain reimbursements for the different services that are provided to those patients, but they aren't enough to fully cover the cost of providing those services and those treatments in a lot of cases. And so Medicare and Medicaid are causing our hospitals and our healthcare system broadly to operate at a loss. And so to make up those losses, healthcare providers shift the cost onto patients with private health insurance, causing our premiums to increase even more. Now, without that option, without private insurers in the ballgame, hospitals and healthcare providers are going to have to find other ways to make up those losses or to cut those losses. And that will ultimately result in longer wait times and less access. I'm married to a physician. I know physicians are really more or less, pressed to go from patient to patient as quickly as possible. We would see that trend get worse. We're facing a terrible doctor shortage in the United States when it comes to primary care. That trend would get worse as the profession becomes, more expensive to get into because the cost of medical training has increased dramatically over a generation, and the pay has, decreased at least relative to how it used to be for primary care doctors. So we're really creating a situation where rather than expanding the supply of healthcare services that are available, we would restrict the supply of what's available, and we would increase demand because people, when they think they're covered by a single payer, system, would just go and seek as much, healthcare as possible. And that's a recipe for a tremendous shortage. And I think bad news for patients because it means we wouldn't be able to access the healthcare that we need. Certainly not the quality of healthcare that we have today, and certainly not the level of innovation that we have today.
Well, let's end on a happier note.
Okay.
Let's ignore the fact that the Republicans failed to deliver on their promises, and in fact now the Democrats control the House. What would conservative reform, so beyond repealing the ACA, what would conservative reform of our healthcare sector look like, and what would it look like from the patient perspective, from the doctor perspective? And sort of to give us an image of what our healthcare system could look like without all of this incredible, I think you mentioned in some of your pieces about this, it's really hard to even call our healthcare market a market. It is so heavily regulated. So what would a less regulated healthcare market look like?
Well, we're beginning to see some image of what this could really be just on the outskirts of our healthcare system, where certain physicians have gotten so fed up with the way the payment pipeline is so convoluted that they're starting to do direct primary care, and they're starting to do more direct pay for healthcare services. This is really the way that we should approach healthcare services that are not catastrophic. So one reason our healthcare system's so messed up is because we've essentially taken the concept of insurance out of health insurance. Insurance in any other context is a backstop against unexpected costs. But in healthcare, we expect our health insurer to pay for virtually everything. So it's more or less simply a third party to every transaction. We could cut the third party out of a lot of those transactions, save a lot of money, make doctors a lot happier, improve their quality of life. I think that their profession is most likely to commit suicide, not just because of the bureaucratic frustrations of the job, but because they're, around sick and dying people more often than most of us are. But if we could move to a model where many of our healthcare services were direct pay, we didn't have to involve a third party, we'd see a lot more affordable and more access to those services. On the other hand, when it does come to insurance, we've got to treat it like insurance again. And that means getting rid of federal and state regulations that require insurance companies to pay for preventive care from the first dollar, and require them to cover a laundry list of services that not every person needs coverage for, and essentially to allow them to offer different patients different types of plans. Not everybody needs the same insurance plan. That was one of the design flaws in the Affordable Care Act. So if people were allowed to purchase a health insurance plan that sort of suited their needs, their level of risk that they're comfortable with, their financial level of risk that they're comfortable with, then we would see people buying much more affordable insurance, buying a lot of health care on their own at affordable prices. And then when they did have a catastrophic health event, maybe they're diagnosed with a disease, a condition, or they have a terrible injury, they get hit by a bus. Then when they go to the hospital or the closest urgent care facility, those costs are covered by their insurance, just like when we have a car accident, our car insurance covers those costs. So we do, I think, have to get away from the employer-centric model, simply because too many Americans, in our generation and as are not working 30 years for the same company, and too many of those disruptions from job to job shouldn't be the reason that our health insurance coverage is disrupted as well. So I think if we could, maybe provide a universal tax deduction or a universal tax credit, that would help transition away from the fact that people with on-the-job benefits get those benefits excluded from taxes. But if you buy your own insurance, you have to pay taxes on those dollars before you can use them in the marketplace. That's a disparity, and it's unfair. And unfortunately, it's really regressive. It punishes people who are, marginalized in society, and it really rewards people who have good, full-time, good-paying jobs. So maybe the left, could get on board with that. I think they ought to. It's just a very politically difficult thing to do, because people, as much as they want change in healthcare, you can see from the way the Affordable Care Act was sold that they really don't want change if they're happy with what they have. That's why President Obama promised, if you like your plan, you can keep it. And that's what's hard about reforming healthcare or any other issue, is that there's sort of now a status quo advantage to the Affordable Care Act. People don't like it, but they're not sure if they're going to like the next thing either. So it's sort of the devil we know now. But I would hope that sometime in the future, if more conservatives were able to have more control over, the legislative process, that we could revisit this issue and really expand the options, expand the choices that are available to people, use market competition to keep costs down, and at the same time provide safety nets for people who, for no reason, no fault of their own, simply have very high healthcare costs. People can't help it if they are diagnosed with cancer, and I don't think they should suffer as a result. I don't think they should become bankrupt as a result. And there are ways to protect those people and focus our government assistance on that smaller group of people, much better ways to do it than the Affordable Care Act did. So that's my long answer to an easy question. What would conservatives do? We just haven't had the chance to, even if Republicans control Congress, doesn't mean conservatives do.
Ain't that always the truth? And as the former owner of a private plan, that high deductible plan prior to Obamacare that only covered catastrophic things, I lost my health insurance along with lost thousands and thousands of other Americans. I lost my health insurance with Obamacare. So happy to hear you say that we should move back towards catastrophic plans. Hadley, thanks so much for enlightening us about healthcare. This is Inez Stepman with the Independent Women's Forum. Thanks for joining us today.
If you enjoyed listening to this podcast, please give it a thumbs up, share it on social media, or stop by iwf.org for similar content.